My name's Nelly Brooks. I'm the catering liaison and diabetes dietitian. I work very closely with the catering department to ensure that the food which the patients get in the hospital meets all the government guidelines and is also suitable for them and that they enjoy it. So in the department there's 4 main teams. You've got the modal team, which I sit in, which is diabetes, metabolics, lipodystrophy. You've then got the gastro team, who see patients with liver issues, digestion issues, people with IBS. There's also the paediatric department. It's also ketogenics, which is a specialist diet that helps people with epilepsy. And there's also the nutrition support team, who see people with oncology issues and cancer. So dietitians are kind of across every single speciality you can think of. A typical day for me would include, firstly, check to make sure that we haven't got any supplier issues. If we have a supplier issue, I have to kind of make an addendum that gets sent to all the wards to let them know any changes in allergies, if we have to send a new product. Speaking to the catering team about different foods which we're providing. So we update the menu every 6 months, make sure there's a finger food option so that patients with poor dexterity and couldn't use a knife and fork can eat. So there's more to it than just picking a dish and putting it on. There's a lot that goes behind the scenes in the background. So when I graduated, my first role was in a community position. It gave me a massive insight into how patients live, because it's okay seeing them on the ward and in that clinical setting, but when they're actually living in their homes, you can make a massive impact to their everyday life. Coming to the hospital from the community role, the catering role is obviously very different from anything else that a lot of people would do. I didn't know whether I'd like it or not, but having done it, I do really enjoy it, and that's what I want to go into in the future of my career. I always thought I wanted to do gastro or diabetes, but doing the catering, I know that's what I want to do. The advice I would have for young people considering a career in dietetics is to get as much experience in a healthcare setting as you can before you start applying. Make sure that you are really aware of kind of what's happening currently in the media, especially around hospital food and even just general public health guidelines around food. And a lot of dietetic departments provide work experience, so coming in and actually seeing what a dietitian does is really beneficial. And a lot of hospitals have food mealtime volunteers, so actually being on the ward, feeding patients, seeing the issues that patients have with just eating, it gives you a really good stead for applying to be a dietitian.